So in Nigeria, I think we have more doctors than patients because everyone prescribes drug to everyone, forgetting that every individual is different, like everything is different from one person to another. We'll be talking about self-medication on this episode of Health Unplug. Health Unplug is the program where we discuss, we dissect, we talk about important health-related issues that matters to everyone. My name is Amazing Rita. And I have with me in the studio the beautiful Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Dr. Rita. You said there are lots of doctors, so
I know. I have.
Let me dash you the doctor title
I used
today.
to, when I was ignorant, I used to be a doctor without certificate. But I have changed.
All right.
You know, I don't prescribe drugs no more.
Okay.
Or one day something will put me inside trouble.
Exactly.
So self-medication is, how would I say it? Like, it's so rampant, like it's an everyday something.
Okay.
People prescribe drugs to people prescribe drugs to themselves, mothers prescribe drugs to their children. And I think it's because, or should I say, I think it's so common because somehow some people have successfully prescribed drugs. Yes.
Okay.
They successfully told this person, I think what is happening to you is this thing. Go and buy this thing. Not even go and say, doctor, go and buy this drug.
Yeah.
And I don't know if I would say it's the mercies of nature, be it the miracle of God. It worked. And the next time when you see them, they are meeting Mama Nkechi and telling Mama Nkechi that medicine worked. I beg, get what they do me. I beg, if you give me
Another one.
And that is how self-medication
Progresses.
And then it's not like somebody is using like a full business consulting. But let's start by saying, what is self-medication? Just for somebody that probably does not understand what we're talking about. What is self-medication, Dr. Favor?
Okay, self-medication is the use of anything. It could be drugs in itself. It could be homemade remedy. It could be over-the-counter medication. It could be herbal medications. Anything at all without the supervision or direction or prescription of a physician in order to treat a symptom or an illness. So that's what we can say self-medication is.
Wow. Anything. So,
Anything.
you know, there are levels to this. Like I said, some people prescribe, some prescribe for themselves. And would you consider taking a drug that a doctor prescribed for you, but not at that particular time? Probably the doctor prescribed because of what was happening to you then. And then probably you felt the symptom was alike. It's doctor's prescription anyways. But then if not at a particular time, then you go to the pharmacy, get that drug and start taking it. Is it
Of course, it's self-medication because at that point, you're giving it to yourself without the supervision or prescription or direction of a doctor at that point.
So why do people do it?
Okay, some reasons why people self-medicate are these. One, someone could feel like, why should I go to the hospital and burn money seeing the doctor when I can easily go to this chemist and get some medications? That could be a reason. Secondly, some people don't have access to good health care. Like in the rural areas now, you could go to a place and then there's no hospital there. They just have chemists. And then they don't have a choice. They can't start traveling all the way to the city to come get health care. So they would rather go to the chemist.
There's pharmacy, there's chemist.
Exactly. They'll just respect themselves and go there and get medications. Some people feel that I was having this symptom previously and then this man gave me this medication. It worked. So why not I try it again? So these are some reasons why some people practice self-medication.
Okay, you said going to a pharmacist or probably anyone who sells drugs Would
Yeah.
you consider that as seeing a physician?
Going to a pharmacist or
Yes.
anyone who
No,
sells.
a pharmacist.
No. A pharmacist is different from a physician. Yes. So a pharmacist could know that this medication has this composition, has this amount of solvent, and what have you, but may not know the actual function of this medication. A pharmacist is a pharmacist, and a physician is a physician.
Okay, let's talk about the effect of self-medication.
Okay.
Especially when you probably took a drug that
Yeah.
worked for you before, but you're taking it now.
Okay.
I believe there should be some effects.
Yeah.
So, what are the effects of self-medicating?
Okay. Some effects of self-medicating oneself. You could see someone just going to purchase medications, maybe over the counter, and then taking them. Let me give a scenario now. This person is having persistent headaches, and then the person just feels, this is common headache. I can easily go to the chemist or
Get
over the
something.
counter and get some medications and take. The headache may subside, obviously. However, you're not treating the actual cause of this headache. You're just treating the symptom in itself,
Yeah.
not the cause.
Oh.
So that medication may just give a temporary relief, but not a lasting solution. So in this case now, you can see that the person has just gotten a temporary relief. And then if the person continues over time, the actual cause is not handled. So this person may get dependent on this medication because the person has not treated the actual cause. So the symptom will continue to persist, and then the
Yes.
person will continue to depend on this
the drug.
medication. It will get to an extent that the dose this person has been taking is no longer sufficient. The person would now want to step up the dose. That will now lead to tolerance. Tolerance is a case where this person now needs a higher quantity of the particular medication to get the same result.
Wow.
Another thing it could do is this. It could mask or make it difficult when it comes to diagnosis. Exactly. Because, okay, let me give another instance. This person has been taking a lot of antibiotics, self-prescribed. When the person now finally decides, oh, let me go to the hospital, you could see at that point, even if they are taking samples for investigations, because this person has been on chronic use of antibiotics, the result would not be the actual thing.
Yes.
We'll get a false positive result. Exactly. So you see, it will make it difficult for the definitive diagnosis to be pinpointed. So these are some effects of self-medication.
Okay.
Yeah.
Okay. So, what are some of the drugs people self-medicate with?
A lot. Like now, someone who is maybe a known asthmatic, maybe the person has always had these symptoms of asthma, and then the person knows that I use these medications or these medications, and then the person goes to get them. Some of the medications used, we have steroids. So steroids could be abused, antibiotics could be abused, NSAIDs, painkillers, various medications. In fact, any medication, like I told you, self-medication is using anything at all. Do you get? So any medication could be abused. Some people even go as, even the common vitamin C, some people abuse it because they could take because, okay, now we know vitamin C has the white and then the yellow, and then the yellow one is sweet. So some people could even take as much as 20.
I don't even think people take vitamin C with prescription.
Exactly. So that's also a form of
I've seen somebody that
self-medication.
takes it like a sweet. He said, I'm not really sweet, so no vitamin C be my sweet.
Exactly. Not knowing that it could, as simple as vitamin C is, it could have an adverse effect. Because yes, it's water soluble. It could be dissolved like it's water soluble. But then taking it in so large quantity could cause formation of stones. So all these things, they have their aftermaths. So any drug could be abused or could be used for self-medication.
Okay. There are some drug that is considered safe over-the-counter drug.
Okay.
And because of that, I think people how would I put it? Like example,
Yeah.
paracetamol.
Okay.
They'll be like, is it not just paracetamol?
Yeah.
After, some people even go to buy another drug and then they recommend paracetamol for them.
Yeah.
So, would you say because people know that it is safe,
Okay.
or they feel it doesn't have
Yeah.
such an adverse effect or
Effects.
whatever, it can be abused?
No. Okay, just like the example you gave for something as simple as paracetamol. Paracetamol can cause liver toxicity. And then it will even get to okay.
But the person is taking it because
Okay.
of something.
Yeah.
But this drug is safe. How would you say taking something safe is abusing it?
Okay. You will say he's abusing it because this person now prescribed it for himself or herself, not the doctor prescribing it. This person may go to see the doctor now, and the doctor won't advise the person to use paracetamol. Yes, for something as simple as paracetamol, like I said, it could cause liver toxicity. Sometimes it will get to an extent that this person has used and used and used this medication and it's no longer working for the person. Yeah. So even if the person is considering it is safe, you could see in the long term it's not safe. Yeah.
Let's talk about self-medication and how it affects pregnant women and their
Okay.
unborn children.
Okay. So self-medication can affect both the pregnant woman and both the fetus, the unborn child. In the unborn child, it can cause growth retardation. It could affect the organ development, especially in the first trimester, because in the first trimester is when organogenesis, that's formation of organs, take place. So it could affect the organs. It could cause growth retardation, such that the baby in utero, in the womb, will not be growing well. And then on the part of the mother, it could cause complications or aftermath. Just like imagine now a pregnant woman saying, I've been having headaches or high temperature, and then she keeps taking paracetamol. I've seen someone like that who on her own just continued taking paracetamol daily.
Daily.
Yes, because she said she was having fever. Exactly. And then, even as physicians, like physicians are very, very, very careful with prescribing medications in pregnancy. Exactly. But she continued to take paracetamol on her own. And at the end, she came down with some liver issues.
Wow.
Yes. So you could see it can affect both the
Child.
fetus and then the mother.
Yes. Why do people believe that they know their body? Like you see people when they even when they are going to the pharmacy, and then maybe the pharmacist is telling you that, have you seen a doctor? Is it a doctor that told you to take this thing? They'll be like, I know my body. I know the way it happens. I know what I want. You know that kind of thing.
Yeah.
Really, especially on this 100-level medical study.
Okay.
So why do people feel that way?
Okay, what I can say is this: possibly this person now has gone to purchase over-the-counter medications, and then it gave her some relief. And then she's presenting with the same symptoms and saying, I know myself, this is what happened to me before. I took this medication and I got better, I felt better. So I know myself. Because of that reason, she could insist that she knows herself. So even when the pharmacist is trying to suggest, why not see a doctor, she'll tell the person, no, I know myself. When I take this medication, I could feel better.
Taking herbal drug,
Okay.
can it be considered self-medicating?
Of course, yes. Like I said, anything, it could be home remedies, herbal medications, over-the-counter medication, anything you're using on your own without direction, prescription of a physician is considered self-medication. So, and the herbal medications, most of them almost always have after effects, especially on the kidney and the liver. Yeah.
Now, would you say some of these wrong diagnoses patients accuse doctor of? But I went to that doctor don't know what he did, that kind of thing. Do you think it can be linked to self-medication?
Yes, to an extent it can. I'll give an instance with a known asthmatic. I told you earlier, one of the medications used to treat asthma is steroids based on the extent of the asthma. Then imagine someone constantly, because the person knows that, I use this medication whenever I'm having symptoms of asthma, and the person continues to take the steroids. You know, steroids have a lot of aftermath, a lot. And one of them, yes, one of them is reducing immunity. It would depress the immune system. So imagine this patient now, after abusing steroids, and then that particular dose of steroid is the normal thing that should be given for an asthmatic patient. But because this person has abused it, for this person now, that amount of steroid may not even work again. You may need to step it up. And remember I told you, steroids have a lot of aftermath. Then imagine another instance, a patient who is a known hypertensive, right? Hypertension is a risk factor for kidney disease. So imagine this patient now, a known hypertensive, and then the doctor has given this patient medications for his hypertension. The patient goes home and feels like, I think I need to add some herbal therapy to these medications. Then the patient continues taking the antihypertensives prescribed by the doctor and combines it with his herbal medications. Then these herbal medications would have it will cause drug-drug interaction. It would start interacting with the one the doctor has prescribed. Secondly, it will start causing harm to the kidney. So imagine that patient coming back later to say this doctor does not know what he or she did. Unknown to the patient that this herbal medication you prescribed for yourself, or you commence self-medication for yourself with this herbal medication, has been interfering with the function of these medications and is equally affecting the kidney. So the patient is coming back with a double problem, the hypertension and now kidney issues. Exactly. So that's an example of a scenario where self-medication can affect the diagnosis of the doctor, or can make it look like this doctor does not know what he or she is doing.
Okay. Now, I was telling you about people prescribing herbal drugs to themselves. It's part of self-medicating.
Okay.
And then why do you think culture has also played a role in people self-medicating?
Yes.
Because you see, if I should put it in the herbal medicine aspect, you see a woman that's pregnant, and throughout her pregnancy, the mom is cooking something, boiling something, giving her something, telling her this will make your baby strong. Okay, I've actually heard that in some part of Nigeria, there's something you will take in your third trimester, and it will shrink the baby, so
so the baby will be able to pass freely.
Labor will be painless. So they will tell you anything where you want, eat. But once you reach that third trimester, once you take the drug, you shrink the. Thinking about itself is disturbing, because imagine a baby shrunken,
coming out shrunken.
Okay, so let's talk about culture. Culture actually affecting the rate at which self-medicating is progressing in Nigeria.
Yes, I think culture has a large role to play in self-medication and its progress in our country. Why? Because previously, in the olden days, most of our parents, our forefathers, grandfathers, and the rest, they didn't have access to drugs.
Yes.
They didn't have access to good health care. Most of them banked on herbal medications. And somehow, it's worked for them. It's favored them. So you can see, maybe those ones who have their grandparents, their great-grandfathers still alive, and then they see their child coming down with this same symptom, they'll be like, I'm very sure that this thing has been working for people. And then they could force the child to use it to get results. But then, remember, what they consumed then and what we are consuming now is not the same.
Yes.
That could be one reason why it could, like, and then normally, yes, drugs are generally gotten from herbs, but then there are one or two things done to them. It's just like now, cassava in itself, it is processed and refined before we get gari from it, because the cyanide part of it is very, very harmful. That's why we need that fermentation. But then in the olden days, you could see that maybe someone could even maybe be sick or having an issue and get a cassava leaf and boil it. But now, if you do it, like the cyanide component of it is very harmful. So you can see that culture has a huge role to play, because they will believe that this worked for them in the past. And then this scenario you just gave. So imagine the woman taking whatever concussion, and then if eventually the baby gets shrunken. So remember that whatever she's consuming is going through the placenta and then supplying that child.
Baby.
That child will not just be shrunken, there will also be some form of growth restriction in that child, because she's taking that, like you said, in the third trimester. So there'll be some form of growth restriction in that baby. That baby would end up being born having some issues, even with organ development. Some organs may now have issues because of what she consumed.
Wow.
So I believe culture has huge role to play in progression of self-medication.
Is there a mental effect of self-medicating?
Okay, yes, there is. Okay, like someone now who, okay, let me give an instance with someone who just comes to the hospital and says, doctor, I've not been able to sleep in the past 1 week. And then the doctor is trying to counsel the patient and tell the patient that I don't just want to start you on medications. If we have a non-pharmacological route to achieve help to this. Non-pharmacological means you're not using medications. Yes, if we have a non-pharmacological approach to this, why not we take the non-pharmacological approach? And then she counsels the patient on what the patient needs to do to help regulate the circadian rhythm, so the patient can now start sleeping. And then the patient goes home and is like, this doctor does not even know what she's saying. She does not even understand what I'm telling her, without practicing what she has told. And then the patient decides to go and start getting medications over the counter. It gets to a point where this patient is already used to the fact that I can't do without these medications. I can't sleep without the medications. You can see it's already affecting them mentally. Yes, and then it's already affecting their mind equally, such that they are now addicted or getting used to the medications. It will further lead to tolerance. Another way I think this can affect the mental health of someone, imagine someone who continues to abuse maybe morphine, a painkiller, and then gets used to it. Before you know it, this patient is spending all his money, all his earnings. I've seen it. I've seen someone like that who cannot do without those painkillers, spending all his money on painkillers. Before you know it, this person is reduced to nothing because he no longer can afford the basic needs of his family. So these are some ways in which self-medication can affect an individual. And when the person gets to that extent of not being able to take care of the needs of his family, carry out his responsibilities, it starts telling on him. Do you understand? He starts feeling like having low self-esteem, depression sets in, and all of those.
So not just mental health that is at stake, even the financial health.
Exactly. Like now, you can see these days now, like here in Nigeria, drugs are no longer cheap. Drugs are now very expensive. Yes. And then some medications could give, like, this person takes this medication and feels high or feels out of the world, forgets his sorrows. Some people even, remember I said in my definition, I said anything. Some people could even use alcohol or cigarettes or just anything. Just, they want to achieve a purpose.
Yes.
Exactly. So you can see it's not just affecting the mental health, it's also affecting finances. Sometimes it could even affect the physical appearance because this person can no longer even get things to take care of himself. So it's equally affecting the way he looks physically, he or she.
That's correct. Is there a way that self-medicating, is there a way that pharmacists can help discourage self-medicating, because you see, there's a difference between I came to buy a drug, and because of the way I frequently buy the drug, it's now showing as if I am misusing it.
Yes.
Especially when, before I come, I already know the drug I want to buy. Once you just see this
exactly, you know that this is what this person wants to get.
So either way, they can help discourage it or help so that they can stop the adverse effect of self-medicating.
Okay, I think, there are some ways. First of all, maybe some agencies, some bodies need to put it in place. First of all, giving strict warning to the pharmacists.
Okay.
Don't sell medications without prescriptions.
I think overseas, you can't get a drug without a doctor's prescription.
Exactly.
That's why even those that take like steroids and the rest, the doctor has to prescribe it before you can get it.
Exactly. That, like you said, overseas where things work. But now you can see the state of our nation and everything. So like some bodies putting it into place that you don't sell a medication without a prescription. That I think that's one way we can achieve it. Secondly, the pharmacist trying to counsel the patient, though everyone is looking for money. So you would hardly find a pharmacist that would not want to sell medications in order to get money. Yes, because of the fallen state of things in our nation. So another way is this: the pharmacist encouraging and counseling the patient. No, I feel you should try to see a doctor first before taking this medication. Another way is this: a pharmacist keeping records. Like now, you could have a record book where someone comes to get medications, you could take down the name and then the medication, so that by the time you notice this patient has come to get these medications frequently, it's coming frequently and more than a particular number of times, you will know that this is now abuse, and then you can tell the person, no, I'm not going to sell these medications to you. So I think these are some ways it can be curbed by pharmacists.
Okay, let's talk about how poverty and lack of access to medical care has actually made foster self-medication.
Okay.
Because if you tell some people that maybe they're telling, I'm feeling this or I'm feeling this, I'll be like, you don't go hospital. They'll ask you, where is the money to go to the hospital?
Yes. So, like you said, poverty, lack of access to healthcare facilities, they are actually important reasons that push or make self-medication to progress. Because just like the instance you gave, someone would rather, instead of me going to the hospital, some people will be like, they'll now send me for multiple investigations. I'll now pay consultation fee. Why not I take this medication, just buy these medications here, and then I'm fine. Secondly, some people will be like, even when I go to that hospital now, there are drugs there, they are expensive. And then why not I go get from this chemist without even considering the quality? Because in as much as you're trying to save costs, you could be doing more harm to yourself. Imagine going to get medications over the counter or from a chemist that is not licensed. The person just has access to drugs, and then those drugs are substandard. Their quality is very poor. And then this patient is taking it and it's causing harm to the organs. So I feel, in as much as the person is trying to save costs, the person is doing more harm. Then in some rural areas, some people may not have access to healthcare facilities. So for this one, maybe they are willing to go to the hospital, but they don't have access to healthcare facility. So they will rather patronize the chemist. Or they feel, the time I will born going to the hospital, these symptoms must have worsened. Why not I get busy? Exactly. So these are some reasons.
So what are the signs that people would notice, and that this thing you are now overdoing it? Because some people would not know that they are harming themselves with paracetamol. Just let me just put it, though there's no drug that is but just paracetamol. They will not know. But when it becomes too much, they will always see signs. So are there some signs that they would see, like to just warn you, or they will notice, and it is a signal that you're
abusing it? Okay. Like I said, any medication can be abused.
Yes.
So, let me give an instance with those people who are finding it difficult to sleep and then they decide to abuse sleeping pills. The moment you see that, once it's maybe 8 p.m., I'm already craving to take this medication, you should know that something is wrong. The moment you're already feeling so anxious and nervous to take this medication, then for some people, like I said, it could affect their finances. You should be able to get to that point where let me tell myself the truth. So
some people will borrow to go and get
exactly. Look how I'm spending just to always have this medication.
Yes.
Some people, like I said, it could also tell on their physical appearance. Like they're now looking very haggard, very tattered. Some people could even have anaphylactic reactions. Some people could have, some people now, they don't know that like some medications, example, sulfur-containing medications could have adverse reactions on some people, not everybody.
Not
That's why when you see a
everybody.
doctor, they want to ask you some questions to ensure you don't react to sulfur-containing medications or this medication. But now some people, because they don't know, they continue taking those medications and then they're seeing those reactions, but they don't know it's from the medications. So these are some things you can see, and then you should know that, I'm beginning to abuse this drug. Or even the pharmacies marking out this particular person, you're always coming to get this medication.
Is everything all right?
Exactly.
Okay. So lastly, before we go,
Okay.
what would you say are the importance of not self-medicating? Like if we're advising people and say do not self-medicate, what they stand to gain?
Okay. When you don't self-medicate, it helps you in the following ways. One, it will make the doctor's work easier. Yes, because when you self-medicate, sometimes it could even cloud the symptoms. The symptoms will no longer be clear. Like I said, someone who has been taking antibiotics now, the person is going to finally decide, because the symptoms are persistent. So the person finally decides to go to the hospital. At that point, because the person has been on antibiotics, it won't give a clear picture of what has been ongoing. Secondly, to protect yourself from getting resistant to this medication. Because when someone gets resistant to a medication, it will make the person spend higher. Because at this point, this medication is no longer working for this patient. So the patient needs to step up. Stepping up, the cost will be higher as well. It will also help the person preserve the organs and lifespan in the long run. Because, like I said, imagine someone always abusing NSAIDs. NSAIDs I told you, they affect the liver because their end products, if it accumulates, it could be toxic to the liver. It can also affect the kidney because there's a role it plays in the kidney. Prostaglandin is something produced in the body. So prostaglandin helps the kidney because it will help to dilate the vessel that brings blood for filtration into the kidney. But someone now that is constantly abusing NSAIDs would stop the production of prostaglandin, and then this person will not have sufficient prostaglandin to help sufficient flow of blood to the kidney for filtration. So you see that person's kidney will start suffering. So, and you know what kidney diseases are like now currently in Nigeria. They are currently on the increase one, and you know what like the financial implication of having a kidney disease. So these are some reasons why we should encourage people around us not to self-medicate. Yes.
All right, thank you so much, Dr. Favor.
Thank you.
A word is enough for the wise, but we're giving them more than a word. Yes. And the thing is that if you are one person that you self-medicate or you prescribe drugs to people, it could even land you in prison.
Exactly.
Just imagine you prescribe drug to somebody and
the
something
person
happens,
takes it and dies.
And something happens to that person.
Exactly.
It could land you in serious prison. So whether you're a chemist, pharmacist, or you are doing your own business in your house, prescribing drugs, you're a self-made doctor, self-acclaimed doctor, please do not self-medicate at any point in time. It is very, very bad. Because, and then again, something can be wrong with your organs, or you can be developing something. That's the problem with self-medicating. Something is causing, according to what Dr. Favor said, something is causing your body to react that way. And you're only trying to treat the symptom. You're not addressing the cause.
Exactly.
And you self-medicating can be worsening the cause that is causing the whole thing. So at the end of the day, you're trying to save money, but you spend more. just should I say, a kidney issue can lead to acute kidney failure, acute kidney disease.
Exactly.
And that is more money because of the small diagnosis, or should I say the little discussion you have with your physician, and they will channel you to the right drug and treat the root cause of the symptom you're feeling. So please, we say no to self-medicating.
self-medication.
Do not self-medicate. Do not advise someone to self-medicate. Do
Yeah.
not encourage someone to self-medicate. Always see your physician before you take something into your body. If you cannot rub anything on your skin, how can you take anything inside your mouth? My name is Amazing Rita.
And my name is Dr. Dimba
And we'll
Fifo.
see you on our next episode. Thank you so much. Do not forget to like, share, comment, subscribe. And if you have any question, we'll drop it in the comment section. We'll help you to clarify whatever it is. And we'll see you next time. It's bye for now.
Bye.